All right, and we are live. Happy Tuesday, happy post Labor Day. If you're watching live, hashtag live, you're watching replay, hashtag replay. This is the voice and the face of Dr. Olabintan again. We're doing another Facebook Live or Instagram Live or YouTube Live, depending on where you're watching, all in the hopes of helping to improve your quality and quantity of life. Our topic today is unlocking secrets to a sharp mind, tips on reducing dementia risk. And I have to say, this is one of the topics I've been very eager to talk about because I've had a lot of people request for something like this. And so if you're watching live, you know someone who could benefit from watching this, go ahead and tag them in the comment section, or if you just simply forward this video to them so they can also watch live, because we'll be delving into different ways that we can minimize the risk of dementia, that D word. And so I look forward to having this conversation with our guest today, who is a seasoned geriatrician. And her focus, as far as her clients, are people who are over age 65. So for my older folks, this is for you. So I hope this is exciting, and you're as excited as I am to have this topic. Now, without further ado, I'm going to bring on our guest, Dr. Aanuoluwa Abiola. I'm going to have her come join us in the studio. Yay.
Hi.
Hi, how are you? Welcome back again.
Thank you. Thank you so much.
All right. I have to say thank you for taking the time to do this talk. I know you're busy. I appreciate you taking time to do this. And without further ado, could you kindly introduce yourself, Doc? Who are you? What do you do?
So I know you introduced me by name already, but I'm essentially a geriatrician. I work in central Wisconsin. So as already mentioned, I take care of patients exclusively age 65 and above. So I don't see anyone younger than 65. For my patients, I essentially what I'm hoping to do for them and I've been working to do for my patients is improve their function, their longevity, and make sure that as we're working through these things that we really are focusing on what matters most to them. And so um, my patients essentially have um, been able to improve their function, um, you know, focus on their goals of care. All those things have been able to be achieved. So I'm excited today to talk a little bit more about our topic.
Awesome, awesome. I like that you empower older folks to do more stuff and stay looking vibrant and feeling vibrant as well. But curious minds want to know, why do you do what you do? What with your niching? Like what was it? Like why?
Yeah. So, I mean, it actually goes all the way back to residency when I became intrigued by the care of older adults. So, in residency, certainly we did have some geriatric rotations, and certainly a significant portion of our patients were older adults. And I felt as if there was like a gap in our ability to care for them and for us to optimize our care for older adults. And so that was very intriguing for me. And then I also found that some of my older adults were the patients that I connected with the most and who I really felt like benefited from the care I was providing. The other things I really enjoyed about geriatrics, which is why I went into it, is because I felt like I was able to tailor my care for each individual patient. I always tell my patients that if you've taken care of one older adult, you've literally only taken care of one older adult because there's such a vast and broad array of stories that they have after the life that they've lived, and
Mm,
in so
mm,
many ways, some older adults are so independent, vibrant, honestly have the longevity and the functional status of maybe even some 40-year-olds. And then there's some people who don't, and knowing how to manage each of them and understanding their each individual needs is so important. And then obviously transitioned after I finished my internal medicine residency into my geriatric fellowship, which really allowed me to hone my skills. And since then, I've been practicing and loving it. So
awesome, awesome. And I like that you said that you tailor make your care to the individual, what's important to them. Because one of the things that tend to happen as we get as we get older, is the fear of losing that autonomy and the ability to make decisions for themselves and do what's best for them, because everybody wants to kind
yeah.
of dictate and say, no, this is best for you. So I like that. So we're going to delve right in. We're talking reducing dementia risk. So my first question to you is this: What are key lifestyle factors that can actually contribute to reducing the risk of dementia? Let's talk preventative. What
Okay.
would you say, Doc?
So generally, when I talk to my patients, I use the phrase, what's good for your heart is going to be good for your brain. And in so many ways, that encompasses so many different things. And it really allows people, everyone talks about heart health in this way, and we focus on that, and it is so important. But brain health at the same time, these two things go hand in hand. So when we're thinking about things that potentially could help, um, simple things, getting appropriate exercise, sleeping appropriately. And if you have a sleep disorder like sleep apnea, actually making sure that that has been tested and rectified or managed, making sure that, we're eating a healthy diet, making sure that we are, um, if there's any other types of health conditions, for example, endocrine or metabolic disorders, making sure those are evaluated, checked, and managed appropriately. All of those things can be very helpful. So it really does kind of go back to that: what's good for the heart is good for the brain.
So exercise is good for the heart. Making sure you're sleeping adequately is important for the heart, and so it's good for the brain as well. All right, let's talk exercise. Just really quick. I'm going to niche down on that question a little bit. How does physical exercise impact the brain health and reduce the chance of developing dementia? Because I have people say, "Yeah, you always like to make everything about exercise. Like,
Yeah.
how does exercise help my brain? Can we delve more a little bit so people are enlightened?"
Yeah, so the brain is a structure that relies on good blood flow. Okay. And if we do not have good blood flow to the brain, we can have a lot of things happen. And for example, stroke is one of the ones that we hear all the time. And even once somebody has a stroke, that is a risk factor for developing further cognitive decline. So if we're able to improve our blood flow throughout our body, this can be very helpful to allow our brains to continue to work in the best way they can for us. Um, and on the other side, patients who do have worse blood flow to the brain, those patients oftentimes we do see that they have worse cognition. So things like that have been very helpful. Also, the brain does have a blood-brain barrier, and there are toxins and things that can flow in and out, and having good blood flow can allow for that to happen more readily.
Awesome, awesome. So you heard it from the doc, okay? Exercise is very, very important for the brain. Now, next question, let's talk diet specifics. Now, for someone who's watching, is like, well, I exercised yesterday, I didn't seem sharper today. Obviously is over time, right?
Yes.
So let's talk, what are examples of people who have actually made some of these changes, like for instance, when it comes to a healthy diet, in improving their or lowering their risk of dementia. What would you, is there a story that you could help or to help answer the question? Like what role does a healthy diet play in maintaining your cognitive, so your ability to think and executively function, and also lower the risk of dementia? Specific diets.
Specific diet. So the one diet in general that people often talk about is a Mediterranean diet. So that's kind of like the general diet. But the biggest thing about these diets is that they're very high in nutrients. So, you know, the fruits, the vegetables, substituting some of the higher fat meats with things that are lower fat in regards to, or have more healthy fats rather. For example, like more seafood in lieu of like red meat.
Right.
Also, making sure that we're well hydrated, getting adequate hydration for our bodies is also extremely important. The brain has plenty of water as well, and it needs to be hydrated to work
Mm.
as best as it can. And then a well rounded diet should have appropriate nutrients. The vitamin D, it needs to have B12, it needs to have zinc and all these other things that are necessary. So if we're eating a diet that's deficient in these things, lots of processed food, we are not going to get all these nutrients that are needed for the best brain health. Um, so I do oftentimes collaborate with our um, like dementia clinic. And one of the biggest things that they tell our patients, especially the patients coming who are looking more for preventative strategies, is diet and exercise. And I think that those together, essentially, it's multiple things. I always say everything in geriatrics is multifactorial. It's
Hmm.
not just one. It's not there's we don't have one key. It's a kind of a culmination of a bunch of different lifestyle changes, but diet always important in the mix.
So I'm going to delve off a little bit because some of these things sound pretty okay. Yes, I should exercise. I should eat well. But how do you encourage patients in that age group? So let's say I have a daughter who's watching now who's like, "Ugh, I tell my parents all the time, listen to me." Do you have tips on how maybe your children could talk to their parents, those who are in the geriatric population, and encourage some of these things because they sound relatively like, yeah, I know I should do that. What would you say to that?
So once again, it comes back to what is this person's specific barrier that's preventing them from being able to. Some people do have a scarcity of food issue. Sometimes people are on a fixed income and they do have a hard time. Some people have a hard time with going out actually and getting their groceries on their own. So it really is more person specific. I mean, some people just hate veggies and some people just hate those kind of things. But the majority of people, if it is honestly made in a way that they um, can prepare easily,
Okay.
or if it's um, a situation where somebody perhaps needs something brought in. So I know things like Meals on Wheels or certain
Okay.
types of food delivery that is set up to ideally be more nutritious and well rounded. Those can sometimes be helpful for individuals so that they can get their appropriate nutrition. But certainly, if there are engaged family members, I mean, honestly, we always say it takes a village to raise a child. It takes a village to support our older adults as well. And if that means, and if we are able to do things like helping with meal preparation or doing the groceries and buying those things that may be helpful, all of those things can help in the end.
Okay, so addressing the barrier, I like how you said that. Sometimes it's not a question. Well, some adults like I don't like veggies. I haven't done them for over 60 years. I'm not going to start now, doc, whatever. But the other things that can be amenable, like oh, it's easier to get it for you if I get it to you, if I prepare it this way, or it's budget friendly. Good
Yeah.
points. Now my next question is this. Now one of the things that I've had people come ask me is like, Doc, are there activities like I could do to stimulate my brain? These are older folks like, I'm retired now. I feel bored. I feel like there's not much to do. I remember I was sharper when I was working. But are there tips on specific mental activities that you generally would encourage your population to do that reduces the likelihood of dementia or keep the brain sharp?
Well, I think that when it comes to exercises or brain exercises or cognitive exercises, so when we're thinking about memory and dementia, I know people always say memory, but when we're thinking about the brain and cognition, which truly is what it is, it's multiple different domains. So we have our domains of recall, we have our domains of organization, we have
Mm.
our domains of spatial awareness, we have our domains of interpersonal skills. All of those things go into cognition and good brain health. So really, if we focus, for example, on or verbal even, focus on that. So things like word searches and things um, like like those kind of memory puzzles at times can help. Absolutely, those can absolutely help our patients. Also, even just like that verbal learning, or even making sure that you continue to have a hobby, an engaging hobby, or learning new things. Taking the time to learn a new skill can be very important, and it can incorporate many of those different domains. So for example, if someone's interested in carpentry or learning photography, or learning to paint if they didn't have time while they were before retirement, or even like dance, all those things require multiple things: coordination, interaction, planning. All of these things are so good for the brain. And so it's not necessarily one thing, but it really is anything that's going to allow our patients to continue to be as engaged as possible and continue to grow.
I love how you mentioned one of my favorites is encouraging people to learn new things. It's amazing what the brain is capable of doing and how that helps also. But I love that. Trying new things. All right, my next question is let's talk stress management. Do you have some effective strategies for managing stress? And especially because of its impact on brain health and dementia risk. What are your tips for our older folks?
Okay, so when we think about stress, so actually, it's been proven that, so certainly cortisol, stress hormone, comes into the body for all of us. To some degree, it is protective, but at some point, it may no longer be protective. But
Mm,
extra cortisol in the body can disrupt our sleep. It can increase our blood pressure. It can affect our appetite. It can affect our energy levels, all of these things. And it's been proven that when older adults' cortisol level spikes, it stays higher longer than in their younger counterparts. And so they're affected by stress a lot more and a lot longer than their counterparts with the same amount of stress stimuli. And that really can affect the brain. And so I know what this is kind of going slightly off topic, but with that stress stimuli, be it from an infection or a stressful situation or something like that, that can actually directly cause some impact on the brain and does contribute to things like delirium, which is
mm,
moving into a new topic, but
right, right.
that delirium can be another risk factor for dementia.
Mention.
So making sure that certainly if there's things that are causing stress, so certainly appropriate sleep. If we can make sure that we are sleeping well, our sleep is appropriate, it's uninterrupted, all of those things can be helpful. I mean, there's many different reasons why people may have issues with sleep, but that's important. Also, once again, exercise is a fantastic stress reliever. So it's it can help with many different things. And some people actually will benefit from meditation, and whatever that means to each person can be different. But certainly, meditation, taking time to be mindful, breathing exercises, a lot of times can be very helpful for our patients. And then, for example, if somebody does practice a particular faith, making sure that it also is part of their daily practice or making sure they're tuned into that. And then also surrounding yourself with people who you feel supported by. That's also extremely important. And then lastly, another risk factor. So if somebody is suffering from something like or dealing with something like depression, which can often
Mm,
happen, that's something else that's very important that we do take time to manage and work to improve if that is something else, because depression in itself certainly can increase the risk of pseudo dementia, and many patients who have depression also have anxiety, and that anxiety can increase stress and cortisol in the body.
all right, I
All
love
right, I love
that.
that.
And you
And you
answered a
asked,
lot of questions in that phrase that you mentioned, support systems, having a community, social engagement, maintaining strong relationships. Those are things that actually help reduce the risk of dementia as well. And of course, we talked about the mental health piece too. So very important that our older folks as well schedule appointments, meet with your doctors, get us evaluated, and make sure other things are not contributing to that as well. Now, my next question to you is this. So, let's say I have someone who's watching who's like, my parents had dementia, my uncle had dementia, or their family members, and they're worried.
yeah.
They've heard what you said, the exercise, they're going to work on doing that. They've heard eating healthy, they're going to work on eating healthier, maintaining social relationships, or maintaining relationships, doing the things, but they're a little petrified on the risk of dementia. I know that's a loaded question, but do you have any words of encouragement to them, even based on your experience, especially since we're talking about risk or tips on reducing dementia risk? Any words of encouragement to them, Doc?
Well, I always tell patients that if you are concerned about your risk of dementia, because it's very true, there is a higher risk in people who have family members and multiple family members who have had dementia. But even the tips that we have talked about today still can decrease the severity of it. Okay. We want to start on as high of a playing field as we possibly can. So that can delay the onset if it is going to happen. That can decrease the severity, as we mentioned,
Yeah.
and allow you to continue to actually function very well. So there are a lot of people who do have dementia and they live with it and absolutely still are functioning in a quite high fashion, but also making sure that you, if you are concerned, and you start to actually follow sooner than later. Make sure your health team is aware of your medical history, and make sure that if you are noticing any changes, or even if you would like to actually start following with like a cognitive neurologist sooner than later, all of those things can be extremely helpful. So it really is a matter of being as proactive as possible, and making sure that your health team is very knowledgeable about some of the things they can support you with.
Awesome. I love it. I love it. So we don't hide and act like, oh, nothing's happening, but instead you make an informed decision. You meet with your medical team members that can help you, and you can start doing these things to delay. I like that. Delay the onset, even decrease the severity of it. So there's always something you can do,
Yeah.
notwithstanding. All
Yes.
right, this is good. This is good. Any last closing words before I have people find out where they can reach out to you and all that good stuff? Any final words for our viewers on the topic of the mentorists?
Um, so
It's a loaded discussion.
I know it's such a big thing. So for me, I feel like at the end of the day, when we are talking about dementia, it can mean so many different things, and some of them are easy. Some types of dementia are easier to kind of manage than others.
Mm.
But if I had to kind of go through a list of the things that I think are most important, make sure you have your hearing checked, make sure you're sleeping well, make sure that if there's any type of electrolyte metabolic imbalances, that those are taken care of. Make sure that, from a cardiac perspective, like we said, what's good for the heart is good for the brain. And if you follow that principle, generally you're going to be going in the right direction. If you are concerned about your memory, make sure to speak to your doctor. If your doctor is not able to, maybe not specialized in that, then they oftentimes can refer you. So if there's a memory issue, speak to someone, start sooner than later, and we can always delay and sometimes decrease the risk. So always
Awesome. Awesome. I like it. There's hope. There's hope.
there's hope. Absolutely.
There's hope, but do your part. I love it. I love it. So, Doc, people are wondering, oh, I like the way you speak. I like how you explain things. Doc, where can people find you to connect with you, either have you come speak on your platforms or to
Yeah.
get more information from you as you do the things you do?
So my social media platform is Geriatric Pro Tips. So Geriatric Pro Tips. So Geriatric Pro Tips, or at Geriatric Pro Tips on Instagram, at Geriatric Pro Tips on TikTok. And then also, if somebody would like to send me an email in regards to any additional questions, or to speak somewhere, or even to just have a conversation, then also Geriatric Pro Tips at gmail.com.
I love it. Geriatric Pro Tips. And I put that at the bottom of the Instagram. We'll let in space between the TikTok and the Pro Tips, but you get the drift. It's
Yeah.
Geriatric Pro Tips. You can find her all over the globe.
Yeah,
Thank you so much for doing this, Doc. I really, really appreciate it. Thank you, thank you, thank you.
absolutely.
All right, thank you all for watching. Shout out to Bernadette. Thank you for watching. Dr. Charmaine, thanks for watching. And for those of you who are watching, I can't see. Next time, please put a comment so I can give you a shout out at the end of the show. But thank you all for watching. As always, sharing is caring. Please share this with your friends, with family members, people who have older parents, older family members, older friends that could use these to help improve their quality and quantity of life. And as always, if you or anyone you know is looking for an awesome AFR and a passionate family physician who have conversations like this to help you live long and well, I am she. Have a good one, everyone. Thank you so much, Doc. You rock.
Take care.
All right, you too. All right.